Well, welcome. Thank you so much for joining us for this conversation. We are so happy at Caring Support to have, say, the experience and insights of healthcare workers as yourself. So, welcome and thank you for accepting our invitation.
Thank you. Thanks for having me.
That's great, Lucy. So, tell me a bit about yourself and your work.
Well, I'm 56 years old now,
Mhm.
and I've been doing this. I've been PSW for about for 25 years now. I thought about being a nurse after a couple of years of doing PSW work.
Mhm.
I went back to school, got my general arts in science to get into the nursing program, and but before I decided to take the nursing program, I wanted to follow a nurse around for about a month
Mhm.
to see if it's something I wanted to do.
Mhm.
And so I followed a nurse around for a month, and I didn't like it. Yeah, number one, I they had no time with the resident. It was in and out because you had to move on to the next one. I just they I wanted to have the compassion with the residents. I wanted to be able to chit chat with them and stuff like that. And when I was doing following a nurse, we didn't have time to do that. So I decided to go against it and stay as a PSW. The reason why I chose it was because I get to spend quality time with a resident.
That's beautiful.
And
Really.
as a nurse, you couldn't spend quality time as a nurse.
Yeah, I understand that the workload of nurses is way higher and they have a wide range of patients to care for at once. So it's hard for them to develop, like intimate, close relationships with their patients because they have no time.
Exactly, exactly. And I didn't didn't want to do that. So I
Yeah,
stayed as a PSW.
that's great. And I can tell by the things you say that knowing your residents' names, first names, knowing a bit of their family history, those are things that are important to you.
Yes, they are. Um, when I first went as a PSW, I thought, oh my God, what am I getting myself into?
Mhm.
I'm like, oh God, I don't know if I can do this. And the nice thing about it though, I fell in love with it. When I went on placement, I had to do 12 weeks of placement. I went to a nursing home. Within 2 weeks of being there, I thought, oh my God, I love this. I
Wow.
just love this. This is me. And I've done many, many other jobs, and they were never fulfilling. You know what I mean?
Mm-hmm.
But this one was. And 5 weeks into my placement, they called my school and said they want to hire me full time.
I
And
see.
out of 32 students, I was the only one hired at the time full time before my placement was done.
It's obvious that the connection you felt with the work, the residents, the employers felt it too because out of 25, you were the only one hired. That's something.
I was the only one that was hired, and I didn't have to go back to school for the last 3 weeks. They put me as graduated because I was hired. Yay!
And
I
that's
was
when your
so
career started. That was 25 years ago, 26?
yes, yes, 25 years ago, and I was just yay! Oh my god! Oh my god! And yeah, and so I've been doing it ever since. I've done different jobs. I've done nursing home care, supportive housing, um, stuff like that. And but nursing homes, it's a lot of work, but that's me. That's where I want to be.
And
Like I said, I've done community care, but it wasn't. It was like being a nurse. You going in, get out, run over to the next one, go in, go out. It wasn't me. you know.
Mm-hmm.
But nursing home was the place for me, and I knew that, so that's where I stayed after that.
That sounds very touching, very moving. And I have a question. What's the average time that a resident stays in nursing homes? I'm just asking because I'm pretty sure it's a decent amount of time that allows you to build a relationship with each one of them.
Well, the thing is, it all depends on their illnesses.
Mm-hmm.
Okay. Um, I've seen a lot of people come in and only last 3 weeks and then pass away. Um, I was so hurt because I've I've seen people come in and stay for 10 years,
Yeah.
and so like 10 years with people. You get to meet their family. You know everything about them. You know what they did when they were a kid. You knew what they liked. You knew what they didn't like. Um, it's just a very fulfilling job. Like, they become part of you. They become part of me. It's like an extended family, and so it all depends on the person that when they're coming into the home. You
I
know.
understand. Yeah. So, can you tell me a little bit about how all of that changed once the pandemic started?
Oh, geez. Um, the pandemic, when it first came, we were up in arms because we didn't know what to expect, what was going to happen, what we were going to do. Um, so it was a day-to-day basis, really, like trying to figure this out, right? Uh, f- Following instructions from the government, following instructions from the Ministry of Health, uh, worrying, scared about our residents catching this and then dying. Like, we didn't want that. I didn't want that. You know, it was very scary. It was very, very scary because we had no idea what was going on when it first hit.
It still is scary.
It is, but we know a little bit more about it now, so we're more prepared now. You know what I mean? Where at
Hmm.
the time we weren't.
Okay. And what would you say since the pandemic started has been the biggest challenge for nursing homes and PSWs?
The biggest challenge is trying to keep the COVID virus out, trying to keep our residents safe. Um, like we shut down immediately. Our manager shut down immediately, and I praise her for that because um, nobody came in, nobody went out. It was just us, and we were all unvaccinated. We know there was no thoughts about even getting an injection and nothing at the time. So we had to, like, okay, we got to keep this stuff out of here. Let's do this. We can do this. And for 18 months we did. 18 months.
And
Sorry.
hmm no, it's okay. I know the emotional part of it. Only PSWs that deal with it every day know it.
It was hard, very hard.
Yeah.
And our residents, they didn't understand. They didn't know what was going on. The cognitive ones were, okay, okay, yeah, I get it, I get it. The ones that were still with us, the ones with dementia and stuff like that, memory loss, um, people with short-term memory loss. It was like, what's going on? Like, so we had to keep reassuring them and keep telling them, there's a disease out there. There's a virus going around. It's very dangerous. We have to keep you guys safe, and we can't let anybody in because we don't want nothing to hurt. We don't want nothing to harm you. We got to keep you away from it. Just constantly reminding them.
You know,
And
it
that
it,
was
it makes
that was
me
hard.
it makes me think of kids. You know how parents had a hard time explaining to little kids the pandemic? Nobody
Yes,
thinks that PSWs also had a hard time explaining those patients with dementia what was going on as well. But that nobody mentions that.
no, and having to tell them over and over every day, every day, every day. It. So well, what I did was I distracted them. I would say, well, let's go over here. Tell me about your daughter again, because I remember you telling me something about her, and I can't quite remember something about a car. And they go, oh yeah, and then they were, they forgot. They didn't worry anymore, and
Mm-hmm.
stuff like that. It was you were always on your toes, always on my toes, trying to make them not worry. Um, about their family, and why isn't my family not coming? You know, um, so we were always coming up with little excuses, like little sayings. Oh well, your daughter has to work really late tonight. Oh yeah, she does, but maybe she'll give you a call tomorrow, right? Stuff like that. Or, oh, you know what we can do, you can see your daughter, we have FaceTime. I'll talk to activities and see if we can get your daughter to, you can see your daughter that way. Stuff like that, right?
Wow, that's hard. And some of them couldn't see their families for what, 18 months?
No, the first time I think it was almost 4 months, 5 months.
Mm-hmm.
And so the activities department, bless their heart, so we can do Zoom.
Mm-hmm.
And so that we set it all up, and so we started doing Zoom. And that made a world of the difference for the residents, even though they couldn't actually touch them, hug them, but they can see their face. They're talking to each other, they're laughing to each other. It was great. I actually spent a couple of times with the resident, with their talking to their family. Like this one resident, um, she's gone now. She didn't die of COVID, but she had issues. And I'd be talking to her and talking to her daughter, because her mother would get distracted very easy. So my job was to get her off what she was thinking about and get her back to her daughter. So it was fun. It was like a game. It was fun. It was really fun. And then the resident would stop and look at me and, like, come on, like, see this right here. This is your daughter. This is. I'm not going to say names, but
Oh, no.
and and she'd be like, "Oh, hi, how are you? We were just talking about you,"
Oh,
and she'd laugh and everything, right? Yeah, it was, just like, I mean, you have to be on your toes. You have to constantly kind of think of something to distract them, to get them off what they're thinking about. Um, and if we weren't sure, I would go and ask a coworker, give me an idea. I'm running out of ideas. What do you think I should do? And then they go, okay, well, let's try this, try this. And then, so we would talk to each other and try to encourage each other to come up with new ideas.
yeah,
It's a lot of work.
it is. But part of the work and the part that you haven't even mentioned is taking care of yourself, making sure that you and your fellow PSWs didn't get infected. How did you manage to do that?
Okay. Oh my goodness. We didn't go anywhere.
Hmm.
I didn't go anywhere. I'm going to speak for myself. I didn't go anywhere. I went to work, came home. Went to work, came home. Didn't go anywhere, didn't do anything. The reason why I did it is because I kept telling my husband, I need to protect myself. I need to make sure
Mhm.
I'm not sick because I need to protect my residents. They're important to me. So you do the grocery shopping
Yeah.
because I didn't want to be I didn't want to feel that I was the one that got them sick because I did something stupid. And it was hard on me. I wanted to go out. I wanted to go do here. I wanted to go there. But my residents were always on my mind. I got to keep them safe. I got to keep them safe. That's my job. I got to make sure that nothing happens to them, you know?
Yeah, I completely understand. Well, as I told you at the beginning, we saw the video that you posted. Was it on social media? You posted it?
It was on Facebook.
On
I have friends and family on Facebook,
mm-hmm.
and going into work that day and finding out that we have COVID in the building.
Mm-hmm.
And and at first it was only one resident, and then it was two the next day. But by the third day we had six.
Wow, it was spreading fast.
Yes, we now have 13 on my side,
Wow.
and two are dead already.
Oh my God.
Two died already.
Of COVID.
Yeah.
Confirmed.
Yes.
Oh my
Yeah.
God, those families.
And so we're back into N95 masks, goggles, face shields, gowns, gloves, all over again. But
Mm-hmm.
this time it's in, and I don't know how it got in, and it just broke my heart. 18, almost 2 years of COVID free, and like I was so proud, so happy that we were doing such a good job, and I just couldn't figure out a life of me. How the heck did it get in? We were
It,
so safe.
yeah, but it's airborne. It's it's nobody's fault, honestly. You've been doing all that you can, and yeah, it's bound to happen with these variants because they're way more transmissible.
Yes, that's what we were told. But it just broke my heart.
Mm-hmm.
All the residents were vaccinated with 4 doses.
4.
Yes,
So very safe. Mm-hmm.
yes, and they're still sick and they're still dying. Yeah, I,
Yeah.
uh, when I did the video, I was hurt. I was upset. I was confused, and I just wanted people to see it, and I just wanted prayer. I wanted prayer to see if prayer would help. With these residents. My family, my friends were. I'm First Nation, by the way,
Okay.
and we really believe in prayer.
Mm-hmm. I do as
You
well.
know, and so I was asking my family and my friends, to send prayers for these people. You know, because I sure was. I was praying every day, every day, every day.
Sometimes that's all you can do, and also look after yourself because if there's COVID in your workplace, you're definitely at risk. So,
Yes, yes. And I've been really like, again, I'm right back. I go to work, I come home. I go to work, I come home. I don't go anywhere,
hmm,
you know?
yeah. And what reaction did you receive from the video? Was the reaction you were expecting?
Oh my God. The response I get was great.
Mm-hmm.
Um, People were saying, Lucy, you're the best, you're a good worker. You're strong. You got a big heart. You love these people. Keep doing what you're doing. Don't give up on them. Don't give up on yourself. Just prayer after prayer after prayer. And it made me feel a lot better,
Mm-hmm.
and because they see me as a very caring person, and I am. I wouldn't be doing this for 25 years if I didn't, and the response was just unbelievable. It just made my day. And um I even went back in and told some of the co-workers, I got my family praying for us. Let's all pray. Let's pray. Let's hope these guys get better. And it brought my spirits back up.
Yeah.
And
Prayer
it
is
made me,
powerful.
yes, and it made me even more courage to have the courage to go back in and do this. They were very supporting. And I was so glad to hear all their thoughts and their words towards me, you know. And but the most part of it brought my spirits up,
That's good
and
to
it,
hear.
it made me want to go back in there and say, "Yes, girl, you got this. Come on, let's go. You got this. You can do this. Let's do it for them. Let's do it for the residents." It was so nice to hear the feedback. You know,
Well,
um,
it definitely touched us at Caring Support. And we that's why we had to talk to you, because we really felt like your testimony is important, and more people should hear it.
well, so yeah, I agree. People should be aware and should hear, and like nursing homes is where a lot of people are going to end up in one time,
Mm-hmm.
you know? And and the thing is, a lot of people hear bad things about nursing homes, you know? But there's people like me out there. They got to remember that. There's people that do care. And we're there. They don't see us 24/7 in the home, you know? They don't see the love that we have for these residents. They don't see the care we give for these residents. They don't see the time we spend with these residents, how we joke with them, make them laugh, we tickle them, we joke around with them, and we play games with them. That's the stuff a lot of people don't see, you know?
Mm-hmm.
And my family, a lot of my family know me, and to hear their words, you're a loving, caring woman, Lucy. You're a strong woman. You always have been. Keep up the good work. We love you. Words like that, it just made my day.
Of course.
And I'm, like thinking, you know what? They have my back. They're supporting me. They're supporting me. They're supporting my home. They're supporting my residents. They're sending prayers. We can do this. I can do this. You know.
Mm-hmm.
It, it's 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 um it's it's really touching. Really, it was really touching. to see the
Yeah.
support I had.
In the video, you do mention that uh, caregivers need more resources in a way. So what are those resources that you feel that would allow PSWs to give better care or do their best even more for residents?
Yeah. Okay. Yeah. We definitely need more staff. We need more staff for sure. Um, and we definitely need more comfortable PPE.
Mhm.
You know, the PPE we have is so uncomfortable. Um, but mostly staff, I think, is we need a lot of staff because right now the ratio is 1 to 11 residents, one person to 11.
Wow, that's the very
Yeah.
thing that you wanted to avoid by not going into nursing.
Right.
Not not having too many patients at once. So I
Mhm.
understand.
And
Before the pandemic, may I ask, what was the ratio?
it still is one person to 11 residents.
Okay, but now
Yes.
they need more care. So
Yes, they need more care, and we're still 1 to 11.
okay.
Um, the government mentioned, I think 4 weeks ago, Doug Ford mentioned that they were going to bring in nurses, PSWs, PAs to come and help nursing home people out because of the Omicron. We're
Mm-hmm.
still waiting. We're still waiting for those people.
Mm,
You know, it it kind of frustrates us at the same time that we're staff are getting sick. So where are these extra workers that the government, the Ministry of Health said they're going to come to help us, to support us? You know,
yeah.
um, that's that's the downside about this, right? But you know what? Regardless, we get in there, or I get in there, and I do my best to go to every resident before my end of my shift. And we have 32 on my side, and I make sure I go in and see every one of them.
So 32 on your side, that's three PSWs, right?
Yeah,
Mm-hmm. Yeah, you're understaffed, definitely.
yeah. And then um, like I said, I'm the bath aide because I'm off the floor now. I went to baths,
Mm-hmm.
and we had to do bed baths because of the COVID, because everybody's isolated to their rooms, right? So bed baths, and I got to do it myself because we don't have enough people to help me. Yeah, because that when I did the video, my back was killing me.
Yeah, I heard.
It was
Mm-hmm.
killing me, you know. So at the same time, when I said that, I was kind of upset that that the we were they made an announcement that we were going to get help, and that was that's the reason why I made that comment.
Yeah, I understand. So speaking of the families of the residents, what would you like them to know about the work that you're doing at nursing homes?
The families that
Yeah.
their family, yeah, I would tell their families, you know, don't worry about them because they're safe,
Mm-hmm.
they're cared for, and we're doing the best and going beyond sometimes to take care of them. And another thing I want to tell the families is, for me, I'm speaking for myself, is my residents is my number one priority. They come first when I'm at work, every one of them. And I do my best to protect them. And I love all my residents. And if you ever go to my home and you just ask them, What about Lucy? And I'm not going to tell you what they say, but just ask them, what do you think of Lucy? And you'll be amazed of what they'll say. Because I put a lot of love and attention in all my residents. And I want to let the families know that, that's my job.
Mm-hmm.
I love doing what I do. And your family is going to be safe with me. I'm not going to let anything happen to them. You know?
Yeah. Yeah, that's I understand. And my last question will be, what advice would you give to somebody that's looking into working in long-term care nursing homes like yourself?
Hey, the number one for me is you have to have a big heart. You have to have a big heart. You have to have patience. If you don't have those two things, you're not going to succeed.
Mm-hmm.
Those are the two big things. And other PSWs that want to get into this, I'm going to let them know that this is not just a job where you go in, do your job, get out, get a paycheck. It's
Mm-hmm.
not like working at a cashier store or a Walmart. You need you need to have a heart, and you need to be a caring person to do this. Because if you don't have those things, you're going to fail and you're going to get burnt out. Uh, you're not going to want to be there. You're going to give up. You're going to quit if you don't have these three things: the big heart and the caring and patience. And they also have to. And another thing is, when they do want to get into this, they got to remember they become our family. And I'm speaking from myself because they are my family. Like I said, I've been doing this for 25 years, and I've worked different places, and I've seen people come in thinking they can do this um, because it's a job, and they end up quitting because they don't understand. They don't have those qualities. You know what I mean?
Mm-hmm.
And so it's very important that you have these qualities in you, because if you don't, you're not going to succeed in this work.
Okay. Well, Lucy, thank you so much for your time and also for your bravery to speak about these things, because I know that to relieve it and speak about it again and then go leave it actually when you go to work is not easy. So I appreciate it. I appreciate your time and your willingness to speak to us. Thank you so much.